Good morning. This is Quiet Echo, and I am glad you are here. I want to tell you about a visit I had this week. I have changed the details enough to keep her private because she is my patient and her life is hers. But the shape of it is true. And the shape is what I cannot put down. She is 26 years old. She is 7 months pregnant. And the first thing she asked me, before she sat down, before I could ask how she was feeling, was how far it is to Millerton in the snow. Let me tell you who is asking and who is answering. I am a family doctor. I have worked in this town for 20 years. I have delivered some of the patients I now see for their own children. I sit in a small room with people on the worst day of their lives, and sometimes the best one. And I have learned, slowly, how often the most important thing in the room is the thing the patient says before she sits down. So when she asked me about the drive to Millerton, I should have understood right away. I did not. I was looking at her chart. Her blood pressure has crept up over her last 2 visits, and I was thinking about the number. She was thinking about a county road in January. We were in the same small room, and we were looking at 2 different maps. Here is what had happened. The hospital where she planned to deliver stopped delivering babies this spring. There was a notice. And then there was no labor and delivery unit. It closed the way these things close now, quietly, in a paragraph, between one season and the next. The nearest hospital still delivering babies is 50 minutes away on a clear day. She has timed it. She has driven part of it in the rain to learn the curves. She has a plan for who watches her older child and a plan for what she does if the first plan falls through. I have been her doctor since before she was pregnant, so I can tell you the planning is not panic, it is competence. She has looked at a problem nobody asked her to solve, and she has solved it as far as it can be solved, which is not all the way. Now I want to tell you something I would rather not admit. For a long time I read patients like her by their numbers. The pressure is up, the visits are sometimes late. The chart records this. The chart does not record why. And a few years ago, I might have written a certain word in her file. The word a doctor writes for a woman who shows up flushed and behind schedule. The word would have been wrong, and I would not have known it was wrong. What changed is the question I ask now. Not only how are you feeling, how far did you come today? Who is in the car if you cannot drive yourself? What happens if the road is bad? The answers are not in the blood work. They are in the 50 minutes. And the 50 minutes are not her doing. This is not only her story. The Center for Healthcare Quality and Payment Reform put numbers to it this year. Fewer than half of the rural hospitals in this country still deliver babies. In most rural places, the nearest one is more than 30 minutes away. In many of them, it is 50 minutes or more. Women did not stop having children in these towns. The reason is colder and simpler. Delivering a baby costs a hospital more than it is paid to do it. And a service which loses money is a service a board eventually closes. I am not on the board. I will not pretend I know what it takes to keep a small hospital from going under. I will only tell you what the closure looks like from my side of the desk, because my side is the side nobody counts. It looks like a healthy young woman planning a birth the way you would plan a long drive through bad weather. It looks like a blood pressure reading I can no longer separate from the road behind it. It looks like prenatal visits I now schedule with the drive in mind, because the drive is part of the medicine now. Near the end of the visit, she asked me a question I have been carrying around all week. She asked me whether she was overreacting. She has done everything the books and I have told her to do. And she was still sitting there, asking her doctor for permission to be worried. I told her the truth. She is not overreacting. The worry is the correct response to the facts. And the facts are not hers to fix. Then I did the only thing the room allowed. I wrote down the name of the labor and delivery floor 50 minutes away. I wrote the direct number, not the main line. I told her to call ahead when the time comes, to leave earlier than seems reasonable, and to trust the plan she had already made because it is a good one. It is not enough. We both knew it was not enough. A body in labor does not consult a map. 50 minutes is 50 minutes whether the planning was careful or careless. I have been a doctor in this town for 20 years. I used to believe the hardest part of this work was telling people the truth about their bodies. I was wrong even about this. The harder part is sitting across from a person whose body is fine, whose town has quietly taken away the one thing she needed, and having nothing to hand her but a phone number and the advice to leave early. She folded the paper once. She put it in her coat pocket. She has a long way to go, and she knows the road. Cedar Valley News has a Facebook group, and you are welcome in it. If a hospital near you has stopped delivering babies, I would like to hear how far the drive is now and what you have done to get ready for it. I will put the link in the show notes. This is Aisha Khalid, your host for today's Quiet Echo. Thanks for listening. Quiet Echo is part of the fictional Cedar Valley News series, written by Evan Swenson, publisher, and Claude Marshall, AI developmental editor. While the people and town of Cedar Valley are fictional, the Center for Healthcare Quality and Payment Reform and its 2026 findings on rural maternity care referenced in this podcast are real.
You've been listening to the Cedar Valley News Podcast, where small-town voices meet the headlines shaping our world. From faith and family to front porches and fields. We'll be back with more stories connecting real lives to real events. Until next time, keep your porch light on, your faith strong, and your heart open. This is Cedar Valley News.